In 1994, a woman was admitted to an emergency room as she was in severe pain. Following her treatment later that evening, the woman sadly passed away. But in a creepy twist, 23 of the doctors suddenly became ill, 5 of which were hospitalized. So what happened? Let's find out. Gloria Cecilia Ramirez, born on the 11th of January 1963, lived in California and unfortunately had late-stage cervical cancer. On the evening of February 19, 1994, Gloria was suffering from severe heart palpitations and quickly got herself admitted to the Riverside General Hospital. It was documented that Gloria appeared to be extremely confused and also had an oily material covering her body that smelled of ammonia, and there was a fruit and garlic-like smell coming from her breath. She had been suffering with tachycardia and Cheney-Stokes respiration. Medical staff began treating Gloria by sedating her with diazepam, midazolam, and lorazepam. But sadly, after almost an hour of CPR, she passed away from complications related to her cancer. Within moments of treating Gloria, medical staff began feeling unwell and even passing out. Others contracted a shortness of breath and muscle spasms. It's reported that 23 individuals became sick, and 5 of them were in such poor condition that they had to be hospitalized. One of the medical experts by the name of Gorchinsky had to endure 2 weeks in an intensive care unit, which resulted in hepatitis and a vascular necrosis in her knees. This started when a medical resident spotted yellow and brown particles floating in Gloria's blood, causing a doctor by the name of Kane to faint and be removed from the medical room. Soon after, another medical expert became nauseated and lightheaded and had to leave the room. Next, a respiratory therapist named Maureen Welch fainted. By this point, enough was enough and the room was evacuated. They also fainted soon after leaving the room. Gloria was dubbed the toxic lady or toxic woman by media outlets, as those that became sick were believed to have been exposed to an airborne disease to their body and blood and led to mass hysteria. An investigation soon got underway, and it was alleged that Gloria had been self-administering dimethyl sulfoxide to control her pain, which converted into dimethyl sulfate, which is extremely poisonous. A report confirmed that the dimethyl sulfoxide and dimethyl sulfate reaction is what made medical staff feel unwell, and it had built up inside Gloria, owing to a urinary blockage caused by her kidney failure. Gloria's family disagreed with this, and 2 months after her death, her body was released for an autopsy and formal burial. Gloria's family pathologist was unable to definitively determine her cause of death because her heart was missing, and her other organs had been contaminated with fecal matter, making her decomposition too severe to investigate further. Almost 3 months later, on the 20th of April 1994, Gloria was finally laid to rest at Olivewood Memorial Park in Riverside. Do you have an opinion on this? If so, please let me know in the comments and please subscribe. Thank you.